Thinking about folks that are in other communities that might be interested in establishing a similar clinic, can you share a bit about how the financing works or other factors that should be considered?
Sure. So the model is a mix of billable services and grant supported services at this time. So our goal, of course, is to maximize all billable services. Of course, all the medical care provided is traditional billable services. But one of the things we are currently underway exploring is the psychiatric collaborative care model, which I just told you about, is technically a billable service. But this was new for many of us. We had not billed for that type of care and we didn't know the nuances. So we're working with billing experts at our institution and nationally to understand, okay, how does this work? What kind of billing is available? What documentation is required? And how do we have to run that collaborative care meeting to achieve the expectations for documentation? And so we're hoping to really become experts on a lot of those billable services that many of us in outpatient care don't currently bill for. And much of it is because we either don't know or it feels very onerous to go through some of the documentation hoops and so forth. So that's an area where we're really working to expand. And then big picture, of course, we're looking at overall sustainability. So over the next 2 years, we'll be planning and hopefully executing an economic analysis of the clinic as a whole to really understand how this model can be most financially viable. And so that will include what services are billable, which ones are not, and perhaps more importantly, what services make the biggest impact, right? And that might be hard to tease out, but it's one of the things we're going to try to understand. Certainly there's times where we may just need to have services available because it's the right thing to do for families, not necessarily because those are services that can be billed for. And that'll be an important part of our analysis.